morning, students. I am Ms. Republica Borgoy, Assistant Professor, Assam Downtown University, Guwahati, Department of Pharmaceutical Science. So, today I will be going to discuss about the abnormal constituents of human urine. So, here it begins. So, first of all, I will want to discuss regarding the normal constituents. So, 95% water, urea, ammonia, creatinine and creatinine, uric acids, allantones, sulfates, phosphates, chlorides, minerals, enzyme and vitamins, etc. are the normal constituents. And traces of substances that are not usually present in urine. Normal constituents appear in abnormal amounts due to defective glomerular ultrafiltration and tubular reabsorption. It includes albumin, glucose, ketone bodies, blood, bile, pigments, etc. Now going to discuss about albumin. Presence of protein in urine is termed as proteinuria. Then in this case, the glomerular walls are impermeable to albumin. Kidney disorders show albumin presence in urine, that is albuminuria. Its causes are glomerular nephritis, piletis, urethritis, nephrosis, etc. Heart diseases, fever, anemia, prolonged hypotension. Orthostatic albuminuria means it is found in persons spending long time in standing posture. So the persons who used to stand for the long time, they are affected from orthostatic albuminuria. Athletic albuminuria is found in athletes during vigorous practice. So whenever the athletes during their practices, they used to do their practices in very vigorous manner, then they may suffer from athletic albuminuria. So adolescent albuminuria, it is found in growing boys. So glucose, major constituent of glomerular filtrate. It is reabsorbed after glomerular filtration. In hypoglycemic patients, reabsorption decreases. Then presence of glucose in urine is termed as glycosuria. It is a symptom of diabetes mellitus. So now coming to the blood cells, presence of blood or RBC in urine is termed as hematuria. Its pathological conditions causes glomerular nephritis, bleeding in UT, that is uterine tract, inflammation in urinary bladder and urethra, and it causes high blood pressure. Red urine means it's not a pathological condition, but it's found in long distance runners. So those athletics who used to run for long distances, may be caused by red urine. So due to damage of blood vessel in the soul. Then coming to the bile pigments, it is associated with liver diseases with heavy destruction of RBC. At liver, spleen and bone marrow, pigmented portion of HB, then biliverdin, then bilirubin. At liver mixed with bile pigments, then helps in fat digestion. Then bilirubin in urine is termed as bilirubinuria. Then urobilinogen, it's termed as urobilinogenuria. Then urobilin, it is termed as urobilinuria, and causes are pernicious anemia, hepatitis, etc. So these are the bilirubinuria and normal urine. Now casts, tiny masses of hardened materials shaped like lumen of tubules, for example leukocyte casts, erythrocyte casts, epithelial casts, etc. And sure sign of glomerular nephritis. Now comes to the amino acid and ketone bodies. Blood amino acid level exceeds reabsorption capacity of tubules. For example, phenylketonuria, that is presence of phenylalanine, and alkaptonuria, that is presence of alkaptone. So defect in the tubular reabsorption, for example, Fanconi syndrome, due to lead poisoning inherited. And cystinuria, it is the autosomal recessive disease. This is the biochemical genetics. And now lastly coming to the nitrites, I define here that urinary tract infection bacteria that can reduce the nitrate to nitrite. Here, the nitrate reductase, it acts as the basic enzyme for the urinary tract infection, etc. So in my next video, I will be discussing about the pathology of blood and urine. Thank you.